everyone. Now we are going to see about these functional expectations of spinal cord injury. So step by step we can see the spinal cord injury and its functional expectations before the treatment protocols. The spinal cord injuries are the result mechanical force that disturbs neurological tissue and vascular supply. And the spinal cord injury can block communication between the brain and the body, which affects a person's sensory motor and reflex messages. An injury refers to an complete or incomplete a neurogenic shock and spinal shock based on whether any movements and sensation occurs at or below the level of injury. And most frustrating is each person's recovery from spinal cord injury is different, and spinal cord affects more men than women. The majority of the people who sustain a spinal cord injury are young adults between the age of 16 and 30 because of the accidents and assaults. And the spinal cord injury affects different levels in the spinal cord. Each condition has different protocols and assessment. Let's see the assessment. The assessment of spinal cord injury is also Asia scale, dermatome and myotomes, and pressure zones, functional balance scale, and functional independence scale. For the treatment plans, we have to consider the functional expectations for the patient with spinal cord injury according to the level of injury, and they have the independent abilities, needs, and dependencies, and attendance care. So, based on these categories, we can frame a treatment protocol or physical rehabilitation sessions. And the independent abilities like electrical wheelchair with help in transfers for level of injury is C1 to C3, and the C4 is wheelchair and pressure relief in power reclining wheelchair, and C5 is self-feeding with setup and use of adaptive equipments, and C6 to T1 bed mobilities and transfers may need minimal help for uneven transfers and cord transfers, bowel and bladder control with the digital stimulation, and manual wheelchairs on slightly uneven ground, and T4 to T12 able to walk short distance with braces like KFO with spinal attachment and crutches and walker, and L1 to S3 walking without braces possible but may need due to muscle imbalance. And needs and dependency for the level of injury C1 to C3 bed mobility and transferred communication devices environmental control are most often needed. So feeding, dressing, and bowel and bladder care, breathing ventilator, and nerve stimulator to the diaphragm.